Hello, everyone, and welcome to the Strength and Hormones podcast. I'm your host, Lauren Papanos. Today, I'm joined by Courtney Scott. She is a midwife, and she is going to be talking to us about everything you need to know about working with a midwife. If you've ever considered it, had questions on it, were uncertain about it, she is going to be answering all those questions for us today. We're also going to talk a little bit about placenta encapsulation. That's something that really applies to the nutrition space with all of this, especially and then answering some questions just about if you were interested in things like home birth, natural birth processes, if this is a conversation that's of interest to you. So thank you so much for being here, Courtney. I'm really excited for our conversation today.
Yeah, thank you. I'm really excited to talk with you. And, I love home birth. I love midwifery care and natural birth. So this is, I'm happy to be here.
Yes, thank you. I appreciate you sharing your wisdom. And I'd love if you just start off by giving us a little bit of an introduction to you,
Yeah,
your credentials, and just some of your background.
yeah, definitely. So I'm a licensed midwife. I'm licensed by the Medical Board of California. My specialty is women's health throughout the reproductive years. So yes, I'm a home birth midwife. I have a private home birth practice here in San Diego, but I also take care of women and families all the way through the female reproductive years. So I offer wellness visits, I offer annual exams, PAPs, labs, hormone testing. I also do fertility and preconception counseling for people who are preparing to get pregnant and they want to be as healthy as possible before they try to conceive, or for families who are struggling with getting pregnant and they want to try more holistic or natural route before going to assistive reproductive technologies like IVF or IUI. Um, and then into the reproductive space, I offer home birth services. So I'm the primary midwife for all of the clients in my practice, which means I provide all of the prenatal care, the labor and birth support, and then all of the postpartum care. And the way that midwifery care is set up is really different than how OB care would be set up, for example. And we can get into that in a little bit too. But that's kind of like that's what I do.
Amazing. And how did you get started in this? Was there a particular interest that you had that drew you to this
Yeah.
field?
Yeah, definitely. So, my background is in alternate healing modalities. I actually, before I came to midwifery, I was facilitating equine therapy for veterans with traumatic brain injuries and PTSD. So, has nothing to do with birth, but what I learned was the art and the ability to hold space for somebody's process, and to hold space for somebody to be able to, work through a challenging experience. And it was really beautiful. I really enjoyed doing that. And around that time is when I became pregnant with my firstborn, my daughter. And when I was pregnant with my daughter, I was not educated on birth at all. I thought, okay, you just show up at the hospital, the baby comes out, like what more is there to it? So I just planned, I went to just my regular gynecologist, and she happened to be an OB too, and did deliveries, and I started prenatal care with her. And she worked in a group practice, so I wasn't seen by her every time. I was seen by a nurse practitioner half the time. And then I went to the hospital. I didn't take a childbirth education class. I didn't prepare. I just like read a book. I was reading this book about, natural birth and how amazing it was. And I was like, oh yeah, I want natural birth, but I didn't prepare at all. So please, nobody do what I did.
Mhm.
Um, and then, of course, I show up in the hospital, and I did have a doula though. So, and she was amazing. And she was such a great support. I definitely highly recommend birth doulas. But at the hospital, I basically experienced the cascade of interventions, right? The thing that a lot of people, especially who are having a natural birth, are trying to avoid. And my daughter's birth was an amazing experience. It was a powerful and beautiful birth, but it was also completely not what I expected it to be. And I felt very underprepared for it. And even more so, I was disappointed with the care that I received from the staff in the hospital because they weren't really respecting my wishes. And, I just felt unsupported in general in the birthing space. And so that experience pushed me to looking into advocating for families and supporting families during childbirth because it's such a huge and deeply impactful life transition that I really believe that people deserve to have the utmost respect and care and love and support during that time. So I soon became a doula. By the time my daughter was 6 months old, I was attending my first birth as a birth doula. I attended a lot of births in the hospital, and I got really burned out on the hospital system, the way that the hospital just kind of moves people through. Um, and just to put this out here, I'm not anti-hospital. I'm not anti-OB. I am pro informed choice and pro, autonomy and people making decisions that align with their values and whatever feels right to them. Um, but for me as a birth worker trying to support people, I felt like the work that I wanted to do, that I was called to do, I wasn't able to do that to the fullest extent while supporting people in the hospital. Um, and I had a few friends say, oh, you should be a midwife, you should be a midwife. And then finally, I attended my first home birth as a birth doula, and it completely changed my perspective on birth, on how birth works really well, and how birth should be supported, and the kind of care and support that people deserve. So pretty soon after that, I course corrected, and then I went to midwifery school. I'm what's considered a direct entry midwife. So there are two different kinds of midwives in the state of California. Each state has different licensure requirements. Thankfully, in California, midwifery is legal, so we are able to practice here. But typically, there are nurse midwives who go to nursing school first and then go to midwifery school. I just went directly into midwifery school, and I'm licensed by the medical board. So, um, and then I trained in a couple different birth center practices, a couple different home birth practices. I feel really fortunate and grateful that I got to learn from so many different midwives. It allowed me the ability to learn so many different skills and techniques and approach styles to how midwives take care of people. And I was really able to see what was most important to me as a care provider and how I show up for people. And I kind of was able to develop my own style in that way. And then I opened my own private practice. And that's what I've been doing ever since for the past 4 years. And it's been amazing. I love it.
Wonderful. Can you just start off by telling us what is a midwife? What are the differences between working with a midwife versus going the more, I guess you would say, conventional route, right? And
Yeah,
working with your OB-GYN for birth.
absolutely. So, okay, midwives and OBs have similar jobs, but there are a few things that we do really, really differently. So, midwives, especially out of hospital midwives, and I say out of hospital midwives because typically in the state of California, nurse midwives will practice within the hospital system. So while midwives are generally more natural minded than most OBs, midwives who practice within the hospital system can sometimes be restricted by hospital policy because they're working within the institution of the hospital. But out of hospital midwives are experts in physiological birth. And what that means is birth that is undisturbed by medical intervention. Unless when needed for a medical scenario. So, for example, our specialty is natural unmedicated birth, and we typically support um, family autonomy, the autonomy of the mom giving birth, and we use natural methods to help support somebody in labor, whether that's position changes or using water as a tool like the shower or the labor tub. A lot of people who have home births want to have their baby in the water. So really just supporting natural birth and working with mom's physiology to help the labor progress and to help the baby navigate the pelvis. We do have training and skills to help manage a lot of birth complications. So we carry oxygen, we carry IV and IV fluids. We can suture up to a second-degree repair with lidocaine. We are neonatal resuscitation certified. So if a baby needs help breathing after they're born, we can facilitate that and help babies breathe. We also listen to vitals at regular intervals throughout labor for both mom and baby. So we listen to heart tones, we take mom's blood pressure and pulse and temperature. We carry medications to stop bleeding, and we carry other herbs and homeopathic remedies. Can we kind of, bring it's like if you were to birth at a birth center, but we bring the birth center to your home. Um, so there's a whole lot that we can manage and do at home. And then if we needed to transfer to the hospital for any reason, we always have a backup plan so that we can, move somebody to the hospital for usually things that we can't do at home, like forceps, vacuum, or a cesarean delivery or an epidural. Sometimes moms, become exhausted in labor, and an epidural can become therapeutic where, if she can get some rest and maybe some Pitocin to help her contractions get stronger if it's been a really prolonged labor, then that can be a tool to help her have a vaginal delivery instead of a C-section. Um, so that's kind of like what midwives do. We are considered medical care providers, which is different than a birth doula. Birth doulas are support people. They're there to give you encouragement and hands-on support and, massage and help to assist you in feeling comfortable. But as midwives, we're actually caring for both the well-being of mom and baby. And then OBs traditionally practice within the hospital system. There are a few OBs who will do home births, but it's very, very uncommon. Um, and OBs are also skilled surgeons. So they are the ones who would perform a cesarean delivery and other surgeries related to women's health. And in the hospital system, birth is much more medically managed than it is out of hospital.
Sure. Okay. And when someone does work with a midwife, they are going to be in your care throughout the entirety of the pregnancy. So, is that correct? Right? It's not just the birthing process; like you're with them from start to finish.
Right, yeah, actually, and that's how it's set up. So we see people at the same schedule that OBs would see people. So once a month until 28 weeks, twice a month until 36 or 37 weeks, and then every week thereafter until the baby's born. At the prenatal visits, we provide all of the same care that somebody would receive at an OB's office. So I draw labs, I refer out for ultrasounds if that's wanted. I, measure the growth of the baby by measuring the fundal height of the uterus. We listen to the baby's heart tones, take mom's vitals. And that's pretty much like, in a nutshell, what you're going to get at an OB office. Usually, OB appointments are going to be pretty brief, 10, 15, maybe 20 minutes. But with midwifery care, we actually spend much more time with our clients. Usually, we're spending about an hour-long visit, and we are addressing more than just the physical needs of how the pregnancy is progressing, but we're asking mom, how are you feeling physically? How are your symptoms? We offer holistic remedies and suggestions for them to help them feel more comfortable, to bring more balance to their body. We're looking at nutrition as the foundation for wellness. And by improving health and increasing wellness, we actually reduce the risk of complications from happening. And that's how we keep people low risk and we have such good outcomes for home birth. When people are low risk and they stay low risk throughout the pregnancy. We also give supplement recommendations, movement recommendations for how to prepare your body to move through the birthing process, to how to help your baby get into good alignment for the birth. We talk about how, the family's doing mentally, emotionally, spiritually. Birth is so much more than just the physical um, event of a baby leaving your body. Whenever you give birth, you're introducing a whole new person into the family. And so, truly, midwifery care is caring for the whole family unit and how everybody's adapting and, processing through this transition of welcoming a new person into the family. So, there are often times too where, people, for example, who have an OB, they don't get to bring their kids into their appointments or their partners into their appointments. But I always welcome families to come into the visits. I often have toddlers or siblings, helping to measure the belly and listen to baby's heartbeat. And it really helps them to connect with the change that's coming. And it really normalizes the process for them too. And, dads and partners are always welcome to be part of the visits and ask the questions that they have. Everybody is just as much equally participating in the experience as the mom and the baby are.
Sure. Okay. And do you ever have patients that decide they want to work with their OB and you at the same time? And if so, how does that process work?
Yeah, definitely. That's called co-care or concurrent care. It does happen from time to time because one of the main reasons why it happens is because insurance doesn't really cover midwives. We're considered out of network providers. There are some health shares that will cover us, which is wonderful. So sometimes people will do co-care, concurrent care with their OB, so that they can get some of like the labs and the ultrasounds covered by their provider. And then whenever they get closer to delivery, they'll discontinue seeing their provider, or there are some there are some providers who will do co-care with their patient and they will be on call as the backup OB, but most OBs don't like to do that. So um, I find that once people start midwifery care, if they're seeing an OB side by side, at some point through the pregnancy, they'll just go with the midwifery care because we spend so much more time together. And as the visits become more frequent towards the end of pregnancy, it's hard to go to double the amount of appointments, you know?
Yeah. Yeah, it's always hard to have 2 hands in the pot too with any treatment because
Yeah.
oh, like, even if you're working with the 2 best practitioners, there's always gonna be differences in
Yes.
treatment recommendations because everyone has a different bias of the lens that they're seeing the patient's
Yeah,
needs through.
absolutely, absolutely. And I have like the majority of my practice, my patients start care with just me and they only see me through the entire pregnancy.
Yeah. Okay. Okay. Wonderful. And then I know you're only doing home births, and you mentioned that there are some nurse midwives that are, doing hospital births. But I think that there's a lot of fear around home births and them being unsafe, or what if something goes wrong and not being able to get to the
Yeah.
hospital quick enough.
Yeah.
What is the actual truth here? Like, is that fear mongering? Is there truth? I mean, obviously, there's truth in that to some extent, but maybe could you provide us like there's some more information around the safety of home births.
Yeah, definitely. So, and that's probably one of the most common questions I get when people come in for consultations for home birth. They're like,
Right.
what if something goes wrong? And the vast majority of the time when we think about something going wrong in a labor, for example, it's usually not something that happens instantly. Typically, there are little red flags along the way, little warning signs that say, hey, this labor is starting to veer off course. And the way that I practice is informed choice decision making, which means I give all of the information to my clients. We talk about all of the options, and then we come together and form a plan together that they feel most comfortable with or aligned with. And so, for example, if we're in labor and we're listening to the baby's heart rate at regular intervals, and then we start to hear non-reassuring fetal heart tones, at that point we would say, hey, this is what we're hearing. We could try X, Y, and Z, or we could transfer to the hospital. Which one do you feel more comfortable with? And everybody has their own perspective of what feels most comfortable to them. And if there's ever a point where as the provider we feel like it is unsafe to be home, we need to transfer, then we can initiate a transfer plan. But as I mentioned earlier, our specialty is natural birth, physiological birth, but our skills and our training are in managing birth complications. So even if something does go wrong, if there is a complication, we have what we need in order to manage the bulk of those complications. And if there's ever a situation where something does need the next level of care, we always have a transfer plan in place. Um, and a transfer plan varies based on how close somebody lives to the hospital, what their preferred hospital is, which, you know, it just depends. You could live in the middle of town right next to a hospital and get to the hospital really quickly, or you could I live out in Ramona, 45 minutes away, 30 minutes away from the nearest hospital. And that's something, we talk about with my clients who live really far out in Julian, for example, where it could take an hour to get to a hospital. We have a conversation about this is what a transfer looks like in the event that we need to go in. And some people are fine with that, and other people are not fine with that. Um, so, it's all about informed choice and what everybody feels comfortable with. But studies do show that home birth is safe, just as safe, if not safer, than the hospital for moms who are considered low risk. So, low risk means no pre-existing conditions that would complicate the pregnancy, like high blood pressure, type 1 diabetes, other, autoimmune issues that could potentially cause some problems. And then no complications that develop during the pregnancy that would make it unsafe to deliver at home, like gestational hypertension, preeclampsia, cholestasis, things like that. And then as long as everything else is normal and within the normal, healthy, safe parameters, birth works really well the majority of the time, especially when it's well supported. Um, and that's what I've seen in my practice too.
Yeah. Well, and I imagine that, I mean, women for many centuries were birthing at home, and this is kind of the natural way of birth, right? So I imagine that there's probably even benefits, whether it's research backed or subjective things that you've seen over the years as well, of being at home and being in a place that you're comfortable and not being in a white, scary hospital room on an uncomfortable bed, right?
Right.
Uh, is that typically what you see? And if so, like what are some of those benefits that maybe you see?
Yeah, absolutely. I think that, a lot of times when people are thinking about preparing for giving birth, we think about, okay, what can I do physically for my body? How can I be strong and healthy? And then, they're thinking about the mindset. Okay, how can I prepare my mindset so I can be mentally strong and navigate this birth and whatever comes my way? But one piece that I feel like is often forgotten about is the hormonal piece of labor. And, biologically, we are mammals. When mammals give birth, we need calm, quiet, dark, safe spaces because that's when all of our love and bonding hormones increase, our feeling safe hormones increase. And the analogy that I like to use is one where, let's say that you and I are walking through a forest together and we're quietly walking and I look over and I see a bear. I can't shout to you, oh my gosh, there's a bear, because then the bear would hear us, right? But as I look over, I get a feeling in my body that rises up like a rush of hormones and emotions, right? And because you're standing next to me, you can sense what I'm feeling. You look over and you see that there's a bear, and then we're able to quietly get to safety. I never had to say to you, there's a bear, but you could sense that something happened, something shifted in my body. And then you were alerted to a potential danger or a potential threat. It's like when you walk into a room and you know that somebody's mad, you don't even have to ask them. And you're like, oh, it feels weird in here. Um, our bodies are very sensitive to one another in that way. And it's that built in, like, biological surviving nonverbal communication that we have. And we're in labor when we're in labor, that's such a deeply vulnerable state because we're literally opening our bodies to allow a new soul to come into the world. And if there's anybody in the room or if there's anything happening in the room that triggers that, oh wait, what's happening? Oh wait, what's over there? There's a bear, right? A theoretical bear in the forest. It changes the hormonal flow in our body. And in order to have really strong, effective, productive contractions, we need lots of oxytocin, which is the love and bonding hormone. Whenever we have cortisol or adrenaline, that directly opposes oxytocin. So the more stress hormones we have, the less oxytocin we have, the less functional our labor is. Um, and I think that, as humans, we have big, smart brains. So we do a really good job at trying to power through in a lot of areas in life. And I think that, in labor, we do a really good job at trying to power through as well. But when we can keep the hormones really good in labor and we can keep the body functioning really well in a state where mom feels safe and calm and protected and loved and supported, it's not just the birth that goes well, but after the birth too. Um, we need those hormones to stay really high after the baby's born because when the placenta comes, we need the uterus to contract in order to control the bleeding really well. And it's all linked together. And so, I think that's one benefit to having your baby at home is when you're in your own space and you're supported by a team of people who you know and trust. You've gotten to know them over the course of 9 or 10 months. That's a really long time versus an OB who you're seeing for the first time and nurses you're seeing for the first time the day that you walk into the hospital in labor. It's a really different experience and it really supports the body in a different way.
Sure. Yeah, I can imagine. And I've always wondered too how many women maybe need the Pitocin to help with those contractions because of that environment where they're not relaxed enough, right?
Yeah.
Um, and I'm curious too with your births, how often you find that women need Pitocin when they're at home.
Yeah, it's really not that often,
Yeah.
honestly. I will say that the number one reason that moms transfer is actually first-time moms with a really, really long labor. Sometimes we get long labors as our first labor, and it's just because it's the first labor and it's the first time the body is opening that way. And, it could be the combination of a first baby plus a baby who's kind of in a funky position and we have to work really hard, and then with enough sleepless nights in a row, the body does get really fatigued. We do a really good job at making sure that moms are eating well throughout labor and hydrating well throughout labor and taking naps and resting when they can, but every once in a while there is a mom who can really, really benefit from a therapeutic epidural and Pitocin. And it really is the difference between a vaginal delivery and a cesarean delivery. And so, there are tools that are available to us at the hospital if we see that they might be beneficial. But the vast majority of the time, women who start at home are able to have their babies at home. And we actually don't use Pitocin to augment or to speed up labor at home. It's not something that we do. So it's actually not an option at home to do that.
Got it. Okay.
Yeah.
Okay. So with home births and having a natural birth, what would be the main like differences in the process versus if a woman's, I'm sure most women that are listening know, especially if they've had a baby before, right? But for those who maybe that haven't, I think it's good to just give an overview of like, what does that mean? What are the differences when someone says, I've had a natural birth or I had a medicated birth?
Yeah, so I think the definition of natural birth, it means something different to everybody.
Sure.
An unmedicated birth usually means that somebody didn't have any kind of, usually it means they haven't had an epidural. But for some people, it could mean they didn't have any kind of pain medication, whether it's IV pain medication or an epidural, or are a couple places in San Diego where somebody can get nitrous oxide in labor, or in the UK, they call it gas and air, as a way to help cope through labor. So that's kind of like unmedicated would mean just your natural coping abilities and your hormones, right?
Natural
Nat-
chemicals.
yeah. Natural birth, some people use that to describe unmedicated birth, and then some people use natural birth to mean a vaginal delivery. So that term is just, it changes depending on who you're talking to.
Okay. So context is important there. Okay. Let's talk a little bit about placenta encapsulation. Can you give us an overview of what it is?
Yeah, definitely. So, the placenta is the organ that your body grows. I just think it's amazing that our bodies grow an entirely new organ just to support the growing baby. And then when the baby's born, the body's like, all right, we're done with this.
Amazing.
Um, so placenta encapsulation is actually taking that organ, and preparing it into a form that can be consumed by the mom postpartum in order to help ease that hormonal transition that occurs after the birth. So the most common form is encapsulation, which is essentially dehydrating the placenta, so drying it out completely, grinding it into a powder, and putting it into capsules so that it's taken like a supplement after birth. There are other women who will take it raw in smoothies. Um, there are some people who will prepare it into tinctures, which are actually great to keep long term for when somebody's going through menopause. I've actually had a few clients over the years who, when they gave birth, their mothers were going through menopause. So they had placenta tinctures made from their own placentas and gifted them to their mothers. And their mothers took their daughter's placenta tinctures, and it helped ease their menopausal hormonal symptoms, which I just thought was amazing to be able to have that like firsthand experience of, seeing multiple grandmothers go through that process, and it benefited them. But typically speaking, the mom giving birth or who gave birth is the one who consumes the placenta afterwards.
Mhm.
And there are a lot of reported benefits. Basically, there aren't a whole lot of studies done on placenta encapsulation. Um, Most of the research that we have is survey based, but generally speaking, moms report that they have increased energy, they have better mood stabilization after birth. There's kind of a mixed feedback on milk supply. Some moms say that it helped their milk supply, other moms say that it didn't help their milk supply. But generally speaking, most women say that they have a positive experience with encapsulation. I personally encapsulated placentas for years. And then more recently, over the past few years, I kind of passed the baton to somebody else. But back when I did encapsulate, I would send everybody a survey at around 6 weeks postpartum and say, hey, what was your experience like? What benefits did you experience? And the results from my own survey study were that 90 to 95% of women said that they had either a positive or a very positive experience, and only less than 5% of women said that they had like they didn't notice any difference, or they had it was like less than 1% had a negative experience with it.
Got it. Okay. And can you share with the listeners what are they getting when they are ingesting the placenta?
It's just their placenta.
And that
Oh, you
contains
mean
hormones and
Oh
nutrients.
yeah, like in the placenta?
Yeah.
Yeah,
Yeah.
so the placenta is a blood organ, so it's really rich in iron. It's kind of like consuming a liver, for example, as
Yeah.
far as like the nutrients. However, the placenta, a lot of people think, ew, I don't want to eat the placenta because it's like a liver, it's a filter, it's going to catch all the bad stuff. But the placenta, although it seems similar to a liver, it functions differently than a liver. So a liver filters out the blood, right? A placenta is more like a gatekeeper. It allows things to flow in to the baby, and it allows things to flow out of the baby and into the mom's system, and waste is released through the mom's bloodstream. So it's more like a gatekeeper. There are, of course, things that are held within the placenta, but there are, things that we encounter in our food and our supplements and the environment that are held in all of the tissues in our whole body. So it's not like the placenta is completely free of everything, but it doesn't hold on to everything like the liver does, for example.
Okay. Okay.
So it's also really rich in protein, of course.
Mhm.
It's high in minerals, high in iron, and it definitely does have hormones too.
Mhm. Wonderful. Yeah, that's awesome. Okay. And how long does someone typically do the placenta encapsulation? Is it that 6-week time period?
Yeah, so it also depends on how many capsules they get, which is dependent on the size of their placenta. But usually there are two different recommendations. The way that I recommend taking placenta capsules is to start off with one capsule, see how you feel, and then you can increase or decrease from there. And then that way you can kind of figure out how many capsules feels right to you, and that can prolong the amount of capsules that you take. When I first when I first started encapsulating, I was taught that women should be taking 3 capsules a day for a few days and then decrease down to 2 and then down to 1. But for some women, I found that that was too much to start with 3 capsules. So I always recommend starting with 1, seeing how you feel, and then adjusting from there. So if you have a placenta, average capsules are going to be anywhere between like 100 to 200 capsules, and you're taking between 1 to 3 a day, you can do the math from there, how many days it'll last.
Yeah, definitely. Okay. Yeah, it's kind of same thing with like beef liver. Anyone that supplements with it, you always want to start slow, work up because it's a
Yeah.
lot. It's very concentrated and all the
Yes.
nutrients it's providing you. But then you've also got the hormones in the placenta too. So that's
Yes.
wonderful. And there's obviously a lot of, safety concerns out there, whether they're valid or not. What are the reasons for the safety concerns? Would you say it's mostly because people believe that it's a filter and that it's gonna be full of toxins and things of that sort, or is there other concerns that people have about it?
Yeah, I think that one is a concern. It's concern that I hear less often. I think more of a concern would be that people are wondering, how do I know I'm getting my own placenta back? Or how do you sanitize everything in between? Because, a placenta it has human blood in it, right? And so we want to reduce the spread of bloodborne pathogens. And so, um, I don't know what everybody else does, but what I did was I actually was so fascinated by the placenta. I took several different placenta trainings, because I had really specific questions about, I can't remember them now, but I must have figured them out. But I had
Mhm.
really specific questions about how the placenta functioned and how this worked and how that worked. And so I was so curious to learn more. I took several different placenta encapsulation trainings so I could learn as much as possible. Um, And each training that I took, they have very similar sanitization protocols with the supplies that we use, and how we make sure that, whenever you get a placenta, you do that placenta start to finish, and then you sanitize everything. And then another placenta start to finish, and then sanitize everything. And really just reducing the risk of cross contamination so that you are ensuring that you are having your placenta and only your placenta, and that there's not the spread of bloodborne pathogens. We also get lab work from everyone right before they're due to make sure that they are negative for HIV, hepatitis, and that their blood work is clear. And then other concerns would be, I guess that, some people feel like, well, if you heat the placenta up, it could lose some of its nutrients. And I haven't really found, there's no way to study that. It hasn't really been studied scientifically, so I can't really give direct feedback on that. But for some women choose to have their placenta encapsulated raw, where it's just the placenta is raw and then it's dehydrated and then turned into a powder, and then other people will choose to have it steamed first, so cooked. And the goal there is to hopefully reduce like any bacteria that's sitting on top of the placenta before it's dehydrated and steamed.
I see. Okay. Okay. That all makes sense. What outside of placenta encapsulation, what are some other maybe more like traditional support resources that have been done for centuries for moms during the birth process that aren't really done anymore that you feel like are really essential for moms to consider?
Yeah, I think the number one thing is rest.
Yeah.
There are many cultures around the world that practice some sort of confinement or laying in. There are different terms that different cultures use around the world. A period of time where, after a mother gives birth, she is in bed resting and healing, bonding with her baby, nursing her baby, and there's like the village, right? The family or friends or loved ones who come around her to help support her so that she can heal and take care of her baby. Our US culture just does not prioritize that, but I feel like with home birth becoming more of a known thing, more people are starting to look into those traditional practices, and they're starting to realize that there are some really, really deep benefits to slowing down, right? Babies slow us down, and I think it's on purpose.
Mhm.
Um, it's very intentional that babies nurse every 2 hours around the clock, right? It kind of keeps you laying low. But when usually what midwives recommend is some variation of 5 to 7 days in the bed, so laying down tucked in the bed, 5 to 7 days on the bed, so kind of sitting more upright, and then 5 to 7 days around the bed, so finally starting to get up and move and stretch a little bit more, but not doing any like housework or heavy lifting. So an average of like 3 weeks in bed is what we usually tell people or recommend that people do in order to support not just their immediate healing, but their long-term recovery as well. So, when you give birth, all of your pelvic floor muscles, they have to stretch out and release in order to accommodate the baby. And then if you're up and walking around and moving with all of the pressure of your organs coming back down in your pelvic floor, that's going to increase the risk of things like prolapse and incontinence and other issues later on in life. Whereas when we heal more horizontal in the beginning, we allow the body the time and space for those muscles to regain their tone without the pressure of everything sitting on top of them. It also decreases the overall amount of time that women are bleeding postpartum when they optimize rest. In those initial weeks, which is great because blood is our life force, right? And our milk is actually made from our blood supply. So the more blood we lose, the more our milk supply can struggle. And the more we're resting and healing and with our baby in bed, the more opportunity the baby has to nurse on demand, which also further increases the milk supply. So, it's all meant to work together. Mom and baby are meant to be in their little nest for some time. And then as you start to feel better and you start to, adapt to the change in the sleep pattern and the routine, then we kind of slowly start to come out of their nest. Um, in addition to rest, I really, really love postpartum belly binding. I think it is tremendous for moms, um, not just to help the abdominal muscles heal together, but to provide support and comfort. There's so much tone and tension with a full, full term pregnant belly, and then after the baby's born and the placenta's born, everything relaxes. That tone isn't there, and it can feel kind of unstable, or your back is still trying to do the job that your core hadn't been doing for so long. And so moms can get a lot of back pain and discomfort. And so belly binding provides that gentle support, to help the muscles come back together, to help the organs find their place, and it just feels so nice. And then beyond that, herbal support, I work a lot with herbs. So I make vaginal steam herbal blends for after birth. I make them for all different kinds of women's health needs, but after birth definitely helps to reduce the overall amount of time that somebody's bleeding. It helps to lift and tone the pelvic floor. Um, it also helps to like heal any perineal tears or hemorrhoids if those are bothering somebody. You can also use the steam herbs for sitz bath. And then, there are other herbs that I like to use for like mood support and stuff like that too.
Yeah, wonderful. And I love that you mentioned the postpartum belly binding because I wanted to ask you some questions about that as
Yeah.
well. Can you just tell us a little bit about what that consists of? Like what is actually happening? Is it something you're wearing 24/7? Is someone taking it on, taking it off? Give us more details on that.
Yeah, definitely. And different cultures have different types of binding that they offer or recommend. So, the type of binding that I do is traditional bandage binding. So, it's basically like a long, elastic kind of bandage, but it's really thin, it's lightweight, it's breathable. And we fold it over a few times and then wrap it side to side along mom's abdomen and then clip it on the side once it's wrapped, and it's intended to be a gentle support. So there are other bindings out there where I don't know if you've seen them before, where they have a really, really long piece of fabric and wrap it around and knot it and wrap it around and knot it. That's going to be a more firm binding, and it's really going to take over the form and the function of your core muscles. The what I love about the gentle belly binding or the bandage binding is that it gently supports your muscles into the proper position, but still allows them to be able to function normally. So what we're doing is, so we're supporting the muscles to regain the tone that they had before the pregnancy. So we're actually supporting the strength building of the core.
Mhm. Okay. What are your thoughts, if you have any, on I know that I believe it's in like Ayurvedic Chinese medicine that they really believe in like during that rest period that you are also resting the digestive system and eating more broth and like liquid based sources to make sure that the digestive system doesn't have a ton of work to do as well. Is that something that you also follow?
It depends on the client.
Uh-huh.
Everybody has different cultural backgrounds that they come from, and also just kind of like family dynamics that work for them and family practices that work for them. I do think that foods that are more gentle on the digestive system definitely help postpartum, especially because if we're doing a lot of resting, we're not up and moving and stimulating the bowels, and so it can cause moms to get a little bit backed up. Whoops, sorry, sometimes. But, I think the most important thing is to focus on nourishing foods and warming foods, foods that are going to bring health and sustain vitality for the mom, and foods that also encourage like a nice, robust milk supply, which is going to be a lot of protein, and, just making sure that moms are well fed, truly, and well hydrated.
Yes, well fed, well hydrated women. Absolutely. I love it. Awesome. Well, this has been so informative. Thank you so much. And appreciate you sharing all of your wisdom and knowledge with us. And I'd love if you could just share with us. I know you mentioned that you're based in Ramona, you have another location in San Diego. What areas do you service, and how can someone learn more about working with your practice?
Yeah, definitely. So I service all of San Diego County. I live in Ramona. I have an office in Ramona, and I also have my main office is down in San Diego in Mission Hills. And if somebody wants to work with me for home birth, they can go to my website. It's midwifecourtney.com, or they can follow me on Instagram at midwifecourtney. And I also recently launched a new online offering. So I just launched the pre-sale of an online course. It's the My Virtual Midwife Masterclass, and it's basically my brain downloaded into an online course for anybody who wants to access midwifery care, but maybe isn't ready for a home birth, or wants to plan a hospital birth, but really wants to benefit from the wisdom and the holistic perspective of having a midwife like in your back pocket, and the masterclass comes with an online community where you can reach or connect with other like-minded moms who are more natural-minded and holistic and going through the journey as well. So all of that is over at My Virtual Midwife. There's a website, myvirtualmidwife.com, and then Instagram at My Virtual Midwife.
Awesome. Well, we will be sure to link all that in the show notes below. And
Thank
thank you
you.
so much for your time today. I really enjoyed our conversation.
Thank you so much. It was great to talk with you.
Likewise.